Hello, my name is Yus. I'm from Leeds, United Kingdom. I'm reporting at the ACR 21 conference on behalf of Room Now. It's really fascinating to see that now we're just about to go 2 years since the pandemic, that more data are available, particularly for rarer diseases such as autoinflammatory syndrome. So one abstract that I am interested today is abstract number 1083. So this study is a registry study looking at whether patients with autoinflammatory syndrome have a worsening of flare or fever during the pandemic. Because as we know, a COVID infection exaggerate inflammatory response, in people. So this is one of the largest study really for rare disease like autoinflammatory syndrome. Most patients had a diagnosis of CAPS, followed by undifferentiated systemic autoinflammatory disease and also PFA-FA. So this is a study where the investigators send web-based surveys to the patients and also their families. Interestingly, during this follow-up, 56% of people did not report any change in disease flare compared to pre-pandemic. In terms of those who flared, about 50% had either low temperature or absence of fever. So this is really interesting that I found. Throughout the follow-up, there were only 7% had COVID, and this mostly mild and were treated at home. And these are probably likely be influenced by patients who were shielding at the time. So this result is quite striking because I thought, people with autoinflammatory syndrome would have had worsening flare or worsening fever. So it just made me wonder after that, when I look back, I think the shielding really does protect these patients, and it probably indicates that pre-pandemic flare could be contributed by viral infections. So therefore, the take-home message, from this abstract, to me, is I think, once we have recovered, from this pandemic, I think people with autoinflammatory syndrome or even, other inflammatory diseases should be, encouraged to have all sort of, vaccination to prevent from viral infections, such as your yearly, flu vaccination and also your COVID booster. So I thought this is interesting, for us. So thank you for listening. You can follow me at my Twitter handle at Yusof, and you can follow more contents at Room Now.